There we are. We're at part 9 on page 1086 of Pregnancy and Human Development. And we're having the baby right at this very moment. We had the initiation and the positive feedback cycles of estrogen, progesterone, and while the decline of progesterone, increase in estrogen, the oxytocin from bébé to stimulate prostaglandin development at the uterus, and then that's stimulating oxytocin from mom once the uterus has its major contraction from the initiation of the baby itself. So that's where we are. It should be noted that sometimes labor is induced by the clinician when it's decided that it's necessary to do so for a variety of reasons, that sometimes a gel that contains prostaglandins is used on mom's lower belly, and it stimulates the uterine contraction in a big way to initiate then the flow of oxytocin from mom. Okay, so here things we see are getting crowded, and baby's head is pressing now downward. We're hoping that the posterior fontanelle at the back of the sagittal suture here, which is to yet become a suture. It's right now. It's, if you were to see this as the head is crowning, it actually looks very thin, membranous, and liquidy at the top of the head. So these are things that can be shaped by the midwife at that particular moment. So we're at the dilation stage here, and we're considering the idea then that at first the superior, it says here, uterine muscle is active, is providing active contractions. The contractions are about 15 to 30 minutes apart at the very beginning, only involving that superior aspect of the uterus, lasting somewhere in the vicinity of 10 to 30 seconds. And these are sort of like wave-like contractions, peristaltic contractions that are 10 to 30, that are rather 15 to 30 minutes apart. And then as labor progresses, the contractions are becoming more rapid, they're becoming more vigorous, the amplitudes are greater, and the duration is greater, particularly as it involves more and more of the uterine smooth muscle. Okay, and the idea here is that the infant's head, through these contractions in wave-like motions, the head is being forced against the cervix with each contraction. Recall that the cervix is what we think of as the neck of the uterus. It has a canal that goes through it. There's an internal os, an external os, and all of this is getting compressed and sort of flattened out or effaced. It's thinned. And then ultimately the entirety of that canal is sort of like becoming, in terms of its diameter, much, much wider. It's dilating. And at that point, we can actually begin to see the crown of the baby's head. Usually we have to get to the place that is about 4 inches in diameter. And let's go on here and note here that the dilation stage, this stage which is actually quite gradual, especially in the first birth, is the longest part of labor, lasting 6 to 12 hours. Okay, so that's why I'm describing this as the equivalent of 2 or 3 marathons, in the sense that this period of contraction and peristaltic-like movement, wave-like movement, is going to be going for quite a while, and it requires breath and focus, concentration, so it's kind of a very long meditation as well. Okay, so several things happen, it says, during this phase, and I'm kind of pointing over in this direction because now the head is causing this dilation. So this is the dilation here. It's supposed to be about 4 inches. And as the posterior fontanelle portion of the crown, the baby's head, is presented, it's remarkably, you can see the head, you can handle the head. It's at this point that the midwife is massaging, or the doula is massaging the tissues, mom's tissues, and also baby's head, and creating a shaping that relieves the stress of mom's tissues and shapes the head so that the head can proceed more easily out through the opening that's available. Okay, so when it's the posterior fontanelle that's presenting the way, and things look very liquidy when you're handling that surface, and so you're being very careful and ginger with your gloved hands. So the next deal here is the expulsion stage, and before I get to that, they're talking here about this little detail up here. So after we have this discussion of it being 6 to 12 hours, there's several things that are happening. The infant's head enters the true pelvis. Remember, we're going past now we're going past the pelvic brim, and we're starting to look at what is the pelvic outlet. So the pubic symphysis is right there, and the coccygeal bone is here. You can't see it because it's a side thing, as the ischial spines are over here. Okay, and so we're expecting this portion of the head to come this way. And in this next picture, it kind of shows that this posterior fontanelle, I would say there's stages here that would be nice to present. Okay, as descent continues through the birth canal, the baby's head rotates so that its greatest dimension is in the anterior-posterior line, which allows it to navigate the narrow dimensions of the pelvic outlet. Okay, so the head is going to come this way. The face is going to be in this position. You can see that the face has just emerged here. If we get to this crowning on the way to expulsion, then we've got an opportunity then, once we've cleared this dimension right here, and hopefully without episiotomy. That's the old-fashioned way, but the tearing is actually too great with episiotomy, and it's better to shape the head. Then the face presents, and you can, with a cool cloth, wipe the eyes of the baby, and with a suction bulb, clear the nostrils and the oral cavity, and make sure that everything is clear and nice for a baby's breath to occur. Okay, so at that point, I guess I'll just point out that there's going to be a rotation, and the baby's head will circle to one side or the other. In this case, it looks like the ventral aspect of the body is this way, so the face will come this way. And then one of the shoulders will present at that point. And once there is the shoulders plus the head, then we get to the stage that could be described as the champagne bottle cork moment, in which everything sort of bursts at that point. There's usually a great deal of amniotic fluid, and baby all sort of come together at that moment and hopefully land in a nice soft blanket. And so we catch the baby, and then of course it's the ideal situation is to place the baby up on mama's belly. There's, as you can see, the cord here is long. There is not a need to cut the cord, actually, leaving the cord intact while the baby is on mama's belly and the head is up toward mama's breast is actually a better scenario. So I've sort of crossed this out and indicated that it's possible to have baby against mom's warm belly, and that baby can possibly be latching onto and suckling mama's nipple, because the reflexes are all set for that to happen. And if it should happen, then ever more oxytocin will stimulate the birth of the placenta at this point.